Our organization across Uganda plans to interactively enhance the quality and availability of education and medical resources in Uganda. Our goal is to send doctors and teachers to help train locals and to also send people to help build schools so that both the education and health sectors can improve in Uganda. Uganda is positioned in South Central Africa. Its economy is based mostly on agriculture instead of industry. Uganda is currently struggling with a multitude of problems that are contributing to its poor conditions. Uganda's population currently stands at roughly 39 million people. They have one of the youngest and fastest growing populations in the world. Their total fertility rate is at 5.8 children per woman, which is among one of the world's highest rates. The maternal mortality rate is 343 deaths per 100,000 live births. Women tend to start having kids around 18 to 19 years of age. Men and women both get on average around 10 years of schooling. The Global Partnership for Education states that the education sector in Uganda is constrained by many challenges. These include a high level of teacher and student absenteeism, weak school level management structures, inadequate availability of learning materials, and large class sizes. A major issue is also the availability of teachers in disadvantaged areas and a lack of accommodation for teachers in rural and hard-to-reach areas. If our organization could help solve some of these issues, it would make Uganda a better and safer place to live.
Our organization is committed to improving the education and health sectors within Uganda. Our top 3 development priorities that our organization plans to address are school availability in rural areas and training and access to both school teachers and doctors. To address the issue of the lack of schools in rural Uganda, our organization plans to partner with Pencils of Promise, a global education nonprofit organization, to build more schools in rural areas. Our hope is that building more schools in rural Uganda will in time help to increase school enrollment, overall education level, and literacy rate in these communities. In addition to building schools, our organization plans to send teachers to schools in Uganda by partnering with Teachers Without Borders, an international nonprofit organization. The teachers we send will have 2 main duties. First, they will help teach classes with a curriculum that focuses on reading, math, and science. Secondly, the teachers we send will train current teachers in the schools on how to teach our reading, math, and science-focused curriculum. By sending these teachers, we hope to increase the literacy rate and overall quality of education, along with the long-term goal of having an educated supply of teachers in Uganda. In addition to improving education, we are committed to improving health, specifically addressing Uganda's high infant mortality rate. Our organization plans to send doctors to Uganda by partnering with Doctors Without Borders, an international nonprofit organization. We plan to send most of our doctors to rural areas to help train midwives, along with supplying any other medical assistance. By sending these doctors, we hope to lower the infant mortality rate, along with a long-term goal of having a supply of locally trained midwives in Uganda. There are some risks that our organization needs to consider prior to implementing our development plan. First, we need to consider the possibility that training new teachers and midwives will stop once our doctors and teachers leave. We will try to mitigate this problem by having the teachers we send to Uganda set up small training programs at their schools that can continue once our teachers leave. Additionally, there may be cultural barriers associated with boys and girls learning in the same environment. In order to prevent female dropouts and neglect in schools, our organization will build separate boys and girls schools. Additionally, our organization will save part of our grant for the future. We plan to give yearly stipends to each community for school and medical supplies, even after the schools are built and our doctors and teachers have returned. In order to prevent corruption with this money, our organization will provide the stipend only if infant mortality rate remains low or decreases, and if the students can pass a yearly exam based off of the curriculum that we set up. Finally, much of rural Uganda has a tropical climate, so we will need to make sure that the schools we build will be able to withstand flooding in those particular regions of Uganda.
A few things you want to continue to monitor throughout the years are fertility rates and mortality rates of infants and mothers, the education level, and how much progress the buildings have made. We want to see if sending and training doctors has made a significant difference in birth and mortality rates. We also want to monitor how many people were trained and see if they have enough experience to take place of the doctors we send. We also want to keep an eye on the teachers and how training goes for them as well. We want to see if the average level of education goes up and see if we can get the average level for both boys and girls to be the same. Lastly, we want to see how many schools we can build in the allotted time and how many more we need to build and where to have the greatest impact. We are aiming to check every year to see progress in the level of education and the birth rates, and close to every 2 to 3 years to check on the progress and quantity of schools. We want to give ourselves 2 to 4 years to build a school and want to aim to build 5 to 10 schools at a time. We also want to give 2 years to train teachers the basics so they can pass down activities and strategies to other teachers and kids. And we want to train at least one for each subject for each school, if not more. Lastly, we want to give 2 years to train doctors, and we want to train and bring 50 to 100 at a time. Given $1 billion, we want to allocate 30% to doctors, 15% to teachers, 40% to schools, and 15% for future funding.